I started getting into CBD because I really wanted to remove the pain. I wasn't,
Right.
there was still pain there, but I was like, okay, this is much more manageable and I feel more in connection with my body. And when I went into the doctor and they're like, hey, everything's looking great. How are you doing on pain? I'm like, yeah, I stopped taking the pain meds in the first week. They're like, well, you can't do that. I'm like, well, I did.
Well, I did. Yeah.
And they're like, well, how'd you manage the pain and the inflammation? Like everything looks really good. I'm like, CBD. They're like, I don't think that does that. I'm like, well, that's the only thing I'm doing is I'm doing CBD for pain and for inflammation. And I've done all the other protocol you guys have said, but it's CBD. Trying to like argue with the doctor about like, I'm not going to do pain meds when that's all they're advising you to do is do that. I was like, why am I having to argue about my care? Like you on this bottle also says like risk.
Right.
It could have all these side effects. And they give you a printout of all the bad possibilities. I'm like, you're giving me something and there's like 29 things on here that could go bad. One of which is death.
Right. And you're pushing
and we
it.
know like the addiction level for people. Why would you push this on me? Why do I have to argue about not taking this and tell you that like you can prescribe it to me? I'm not going to get it. I had another surgery and I come out there. I'm like, hey, I don't take pain meds. They make me really sick. I don't like them. And they're like, you cannot do this surgery if you don't actually take this prescription. So I have to pay for a medication I'm never going to use. And I told you guys, and I'm like, we'll just give you a different one that'll agree with you better. I'm like, no, it's not. I don't want to do this. Like, I'd rather not. And they didn't even give me an option.